Good morning, everyone. My name is Anna Stec. I lead on Scan4Safety England, NHS England program. Thank you very much for the invitation to this fantastic event. I'll give you a little bit of overview today about our program, what we're doing in England, a little bit of background history, just a reminder where we started, what we've achieved so far, and what are our plans in the near future. So a little bit of a background to start with. Scan4Safety was launched originally by the Department of Health and Social Care in England in 2016, and this innovation was aimed at improving operational efficiency, reducing costs within national healthcare services in hospitals. There were 6 pilot demonstrated sites that use barcoding technology in their hospitals to streamline the tracking and management of medical supplies, equipment, medication. And it also highlighted improved traceability of patients as part of that program. And overall, Scan4Safety pilot was concluded to be a success, and with strong recommendations to expand the use of barcoding technology across NHS to achieve similar benefits on larger scale. So that was in 2016. In 2020, we had Ian Patterson's inquiry, and the back of that, we then had, following that inquiry, we had subsequent publication of Camberlogist's report titled First to Do No Harm in 2020. And that report highlighted significant concerns about patient safety, and it called for systematic improvements within the NHS. And this led to NHS England as an organization that renewed commitment to Scan4Safety initiatives. And this renewed effort significantly focused this time on enhancing patient safety by implementing scanning procedures in surgical theatres as a priority this time. And we aim at that, as part of that project, to ensure precise tracking of medical implants and instruments in theatres, and therefore minimizing risks of errors, improving surgical outcomes, and ensuring that every step of surgical procedure is documented, traceable. So this time it was more focused on patient safety, and this, since 2020, this project and this focus is still ongoing. But in 2023, a new mandatory national medical device outcome registry was launched, a program that is supposed to systematically collect and analyze information on all high risk, so class 3 and 2B medical devices. And this registry aims to enhance the monitoring of device performance, patient outcomes. It aims at ensuring that high-risk medical devices used within the NHS are safe and effective. And in alignment with this initiative, the government's mandate in 2023 stipulated mandate to NHS England stipulated that by March 2024, all NHS trusts must implement barcode scanning of high-risk medical devices as part of that broader Scan4Safety program. And this mandate emphasized that commitment of healthcare service to integrating advanced tracking technologies to improve traceability and management of medical devices. The same year, 2023, we had publication of NHS commercial strategic framework commitments, and in a few different places of that strategic framework, it mentions promotion of Scan4Safety as a priority, and that is to improve patient safety, traceability, operational productivity, and supply chain efficiency. And aligned to Scan4Safety, NHS supply chain program will accelerate the adoption of integrated inventory management capabilities across providers to deliver that demand to help us set those foundations for Scan4Safety and achieving also patient benefits across the system. But this is the first step to achieve that. And so, like I said, NHS Supply Chain has now a program called Interest Inventory Management Systems, IMS pilot project, which we'll hear about more after my presentation. And that introduces electronic IMS to inventory management systems, point of care, and analytic functionality. It focuses on enabling visibility of high value medical devices, but also high risk medical devices, which is very helpful, um, like I said, to set that foundation, that first entry point, enabling Scan4Safety rollout in theatres and also other clinical areas in hospitals. So now I'd like to talk a little bit more about Scan4Safety, NHS England team, what we do, who we are. So Scan4Safety England sits now within NHS England in Medical Directorate. It's part of National Patient Safety Team, specifically sits under National Digital Clinical Safety Team. The head of the program is Tracy Hallihay. We are a small team, but we have a variety of skills and different experience that we bring to the team. There's me with my clinical engineering background and benefits realization background. There's Phil with his nursing background. James is our comms and engagement lead, and we have Scott who helps us with project management, data management, and events coordination. We're very passionate about Scan4Safety. Um, and very happy that our team is growing. As part of the work, the wider commitments of our program, Digital Clinical Safety Program, we published strategy, which has been refreshed last year, and that Digital Clinical Safety Strategy has two main aims when it comes to digital safety. First one is to improve the safety of digital technologies in healthcare now and in the future. And the other one is to identify and promote the use of digital technologies that improve patient safety challenges. And specifically, Commitment 4 talks about accelerating adoption of digital technologies which record and track implanted medical devices. And that's where this link to Scan4Safety is. And as part of that work, our priorities continue to be to promote Scan4Safety and its benefits, to coordinate work of our partners, and to help NHS providers navigate legal and regulatory requirements in relation to barcode scanning and data submission, because NHS's system is so complex and we know that things are changing rapidly. Legislation governance is changing very frequently, so we want Scan4Safety, the main point of contact for provide for our for the trust that we work with and solution providers. Our priority is also to evaluate and communicate patient safety benefits of scanning solution more widely, and to utilize patient safety networks and expertise to support safe implementation Scan4Safety, since we are now part of a national patient safety team. I would like to talk a little bit about the Scan4Safety initiatives that we're currently involved in. So our main focus is still to make sure that every theatre in the country has Scan4Safety and that implantable medical devices are properly tracked and traced, and that data is submitted to Outcomes registries. But we now started to branch out and get involved in other programs and initiatives where Scan4Safety potentially will improve patient safety as one of the benefits. And so what we've been involved in most recently is, for example, verification of patient identity using the wristbands, and that's on the back of HSSIB report on positive patient identification that has been published a few months ago. We are working on point of care scanning to match product data to patient data in the blood transfusion pathways. So that's as a result of the infected blood inquiry report, which has been published in May. We're now working with blood and transplant, NHS Blood and Transplant, who are looking at publishing strategy to improve patient safety going forward. We've also been working with initiatives around scanning patient wristbands together with electronic prescription records that confirm that match, and also initiatives that enable the introduction of robotic dispensing systems that heavily rely on barcodes, GS1 barcodes being printed on boxes of medication. So this all those initiatives are related to closed loop medicine administration program. We've also worked with medical device outcomes registries on recording implant serial numbers in patient records and central registries, like I mentioned before. We work on a unified validated benefits realization approach for the NHS. Together with supply chain and the pilot that they're running at the minute, they're looking more at it from the perspective of inventory management improvements and the benefits um, that benefits that are possible to realize. On the back of that, we focus on patient safety benefits, but together we want to create that unified framework that trusts around the country can use. And finally, tracking assets and medical devices throughout the network of facilities. So we're talking about NETIS initiative driven by supply chain, or PIM program, which is DHS is leading on that program, and it's about having that better visibility of mobile medical devices around and across organizations. So it changed from that initial Scan4Safety program in a way that now we see Scan4Safety initiative as an umbrella term that represent all those collaborative efforts of multiple national programs and stakeholders, and we all working towards that common objectives. Those common objectives, which are improving patient safety, clinical effectiveness, and operational effectiveness. Here's just a quick overview of our partners. I've mentioned them already before. GS1 UK, Supply Chain, MHRA, DHSA, MDHSC, NHS Commercial, Outcomes Registries. We also work with foreign nations, across foreign nations, because they are implementing Scan4Safety as well in their own different ways, and we can learn and share our experiences and learning from this process as well. So like I said, it's a very collaborative effort at the moment, which is great, obviously. I would like to just very quickly run through available resources and what we already have available to everyone. I would encourage everyone to use. First of all, Scan4Safety website. We refreshed website last year. It contains and provides information about Scan4Safety, supporting evidence of its benefits and where it can be used, or scanning barcodes can be used to improve patient safety. Information about Scan4Safety partners, related programs. You can find links to their websites, understand a little bit more how what they are currently doing that aligns with Scan4Safety objectives and goals. There's guidance for trust, suppliers, and solution providers, and we'll welcome your feedback on what other resources and information would be helpful or you feel that is missing on the website. We'll be very happy to provide and work on developing those resources as well. We have Digital Clinical Safety NHS Futures platform, and as part of that page, we have Scan4Safety page, which has documents and resources for trusts. It also has forum for discussions and networking. Obviously, NHS Futures platform is a little bit different. Its website is much more public facing. Scan4Safety Futures platform, you have to apply for authorization um, of your joining our page, but it's open to suppliers as much as it is to NHS email addresses. So please just try to register. We'll get your information about your inquiry, and we will authorize you so you can use our page as well. And then finally, we have Scan4Safety Twitter account, where we repost news related to Scan4Safety from across the system. We also share work and success stories of our partners, NHS Trust, and any other information that is relevant to Scan4Safety tracking and tracing across the country. I would like to take this opportunity because it's already first time since a long time that we are engaging with suppliers and solution providers, and I would like to talk about DCP standards. So this is DCP standards sit within wider digital clinical safety strategy within IT program and our program, which is more about patient safety. But they are relevant, and I feel like they're not fully understood or not always used. So I would like to first just give a very quick overview. DCB standards have been developed by NHS Digital a few years ago, and they ensure the safety, quality, and interoperability of healthcare information systems used in the UK. There are two main ones, DCB 019, and that standard is aimed at manufacturers of a health IT system. So this is a clinical risk management standard, and its application is in the manufacturing of those systems. And it helps manufacturers of IT healthcare systems to identify, mitigate risks in system developments, ensuring that their products are safe and reliable and meet NHS standards. And then we have the second standard, which is DCB 0160, and application of this standard is more about deployment and use of health IT systems. So that's where manufacturers and suppliers can expect organizations, NHS organizations, to run their own risk management and risk assessment during the deployment and use of health IT systems to avoid many pitfalls and issues with using those systems. So it's just to raise an awareness in the first instance that those uh, standards exist, and I would like you to become more familiar with them. I've posted interesting article about it and also a step-by-step guide to understand which systems have to comply with DCB standard and which systems are also considered medical device, so they have to also um, um, meet other national requirements and standards related to medical device software as medical device. But those two standards are for any IT healthcare system, also those which are not medical device. DCB 1077, that's a little bit different. That's a standard that captures requirements around patient wristbands, and automatic identification and data capture of patient identification. So also would like to bring your attention to that as standard, as many trusts have raised that they're not sure how patient wristband should look like, what information it should capture. So that's the standard that can help you understand that a little bit more. Um, Sorry, and just to say, as part of that, I would like to run a quick survey and ask today's attendees to let me know if there would be an interest in attending a webinar that would be part of that would talk about a little bit more detail about those standards, the DCP 0129 and also 0160. Understand a little bit more how they're used, how to implement them, and also opportunity to ask us questions so we can answer them and clarify any of those confusions or uncertainties. So we'll run a survey in a minute. And just to say thank you very much, here's my personal NHS email address. Feel free to drop me an email if I can help. But that we also have our digital clinical safety email, where we will be able to answer your questions related to Scan4Safety or digital clinical safety. Thank you very much.